Another common procedure performed for the shoulder is total shoulder replacement. And that procedure is generally performed for patients who have an arthritic shoulder, and that usually is associated with significant pain that is associated with reaching overhead or behind your back or laying on that side, and commonly pain at night.
Anatomic total shoulder replacement in the past had somewhat of a variable reputation, and part of that was the indications weren't well defined.
One of the reasons I love doing this procedure is that the science of orthopedics has really grown by leaps and bounds in this category over recent years.
And today, understanding the cause of the arthritis and then the appropriate treatment has allowed the success of this surgery to go up dramatically.
So what this means for my patients is that when I perform the procedure, I'm able to use a minimally invasive technique, which translates to less pain to the patient and durable long-term pain relief.
Now we're really using specific types of shoulder replacements for specific types of conditions. For instance, patients that have arthritis that results from a chronically torn rotator cuff are good candidates for what we call a reverse total shoulder replacement. And what that is the old socket is replaced with a new ball, and the old ball becomes the socket. The other muscles of the shoulder take over and provide, in many cases, excellent range of motion for the patients.